Welcome to Sports Ophthalmology, a podcast for ophthalmologists and trainees interested in providing eye care to athletes. I am your host, Jared Tuttle. Join me as we hear from national leaders in this exciting subfield of ophthalmology. Dr. Kevin Everett and Dr. David Goldman are comprehensive ophthalmologists at Henry Ford Hospital and share responsibilities as team ophthalmologists for the Detroit Pistons and Detroit Lions. Dr. Everett received his undergraduate and medical degree from the University of Michigan and completed his ophthalmology residency in Cincinnati, Ohio. Dr. Everett has worked with the Detroit Lions since 1999. Dr. Goldman received his medical degree at Saba Medical School and completed his ophthalmology residency at Henry Ford Hospital, where he currently serves as residency program director. Dr. Goldman, Dr. Everett, thanks for taking the time to talk to me today.
You're welcome.
Pleasure.
So how did each of you start getting involved with sports ophthalmology?
You want to go first, Kevin, since you've been doing it longer?
Yeah, I guess I'm the old guy, so I will. Actually, I joined Henry Ford Ophthalmology in 1998, and then in the summer of 99, my then chairman, Julian Nussbaum, said that he wanted to know if I would be interested in helping out the Lions because he knew I was a football fan. And I was like, sure, I got season tickets, I thought, I'll be around. He's like, well, we're going to go up to training camp, meet the staff, and, they've had an optometrist kind of doing their eye stuff, so I wanted them to have an ophthalmologist. Sounds good. So we went up back then, they were training in Saginaw State University, and I met everybody, and I still thought, this would be nice. I'll be in the stands and have tickets anyways, but I didn't realize that actually they wanted me on the sidelines. So I was pleasantly surprised. So after spending my whole life going to Lions games and rooting for the Lions and being at the Silverdome, I found myself on the sidelines first in that fall of 99. So back then in the NFL teams, it was not the behemoth you see now. There was only myself, one internist, two orthopedic surgeons, and a chiropractor, believe it or not. Those were the medical professionals on the sideline. There was no team neuro, there was no league neuro, there's nothing else. And so I would do things like help with IVs, give shots, suture wounds, actually being a physician, an MD, kind of doing a little bit of everything. So that's where I started. That's how I got involved to begin with. David?
My journey started certainly as a resident when I saw Dr. Everett going to the games, and I believe as a first-year resident, I asked, hey, man, anything I can do to help out, let me know. I'm willing to carry your indirect bag, whatever you need, I'll be there. Need me to clean your shoes before the game, and unfortunately, that didn't amount to anything during residency. It wasn't until I was a staff member that I started assisting in the Lions games, and
that wasn't my fault. They just didn't allow us to have a resident on the sideline. So
when the Pistons switched locations from Pontiac down to Detroit, I immediately called the primary care physicians that would be taking care of the Pistons. Said, hey, you guys need eyes, don't you? And they said, yeah, you know what, we do. Yeah, that'd be helpful. And because no other physician wants to touch the eyes. And so, I quickly, let them know of our commitment, our availability. And they said, yeah, we need you. Please be there. And that kind of set the tone for certainly our involvement with the Pistons, and kind of created a platform for other sports teams to kind of search us out and say, hey, can you do something for our team as well?
So, Dr. Everett, how have you seen sports ophthalmology change over time? You mentioned a little bit, but could you speak a little bit more to that?
I'll start with it, but David will take the mantle, because one thing I'll say is that, I've been involved. This is my 25th season, but David is really, since he came and started helping with the Lions and then got the Pistons for us, he's really kind of been involved in a little more detailed way, because I guess the way I could explain it changing is when I started, there were, an ophthalmologist at the league office, and we basically were around for eye injuries, not migraines, concussions. We were the guys that I had to determine if somebody would go back in the field. We didn't have any neuro people. And of course, off season, eye needs. I did LASIK on a lot of players, that sort of thing. But there wasn't anything too much beyond that. There was a sports ophthalmology society that I think eventually went defunct, but it's only been in the last 10 years, especially the last 5 years, that I think the field of sports vision, attested with you interviewing us, has really kind of become a much bigger thing. And that's where I think David is gotten us involved, not only on his own, but with residents and studies and different things. So in terms of how it's progressed, I'd let David kind of answer that in terms of the last decade, David.
Yeah, I think you hit the nail on the head there, Kevin, because certainly even when I got started, we were mostly there just for sports trauma. Anything around the eye, anything around kind of the chin upwards, depending on the amount of staff that they have on the team. I mean, the Pistons run pretty lean but like most NBA teams with a primary care that's kind of specialized in sports medicine and orthopod, a dentist, because we've seen plenty of dental injuries at basketball games, and then an ophthalmologist. And that nice small team, you really get to know the other physicians well, a lot of camaraderie there. But as Kevin alluded to, the whole sports vision has kind of popped up out past 10 years. And it's focused more on sports vision training, trying to enhance athletes' vision to the maximum potential, recognizing there's a static visual acuity, but also a dynamic visual acuity, trying to work with anything with vision motor skills. And where we really see it play the biggest role probably is in high school level sports and college, early college. Certainly, it's a tough sell for a professional athlete because by the time they've gotten to the professional ranks, they have their regimen. They know their training, and it's gotten that far. It's hard to argue with that level of accomplishment. So to try to enact, talk to the physical trainer, say, hey, you guys should really implement this into your training. Unless there's a glaring problem, or if there's just a trainer that's really excited about that opportunity, it's a tough sell for the athletes. But it's growing, and I think the more it grows, the more that the athletes want to have it in the locker room. And so there's just going to be a growing demand and opportunity for ophthalmologists interested in this field.
I was speaking with one ophthalmologist, and they talked about the importance of having an individualized, tailored approach for this performance vision enhancement through vision training. And so is this kind of something that you offer in general, in mass, to all the athletes? Or is it more of selecting like maybe one athlete, one patient at a time? I think you would really benefit from this. Here's what we have to offer. Or what does that process look like?
I think what I appreciate the most is the opportunity to work with our colleagues in neurology, and particularly when it comes to concussion protocols. Is there something that we can do to kind of enhance the improvement or make recommendations for it? Are there instruments that we have that the player could take home and work on at home, do their home exercises with it? So at the beginning of every preseason, I let them know that these resources are available. Certainly, if they want to do a training program, that's great, but it's rarely utilized at a professional level. Outside of perhaps maybe if they're trying to get a patient or a player back post concussion. Off season, at exit interviews, I try to let some of them know, hey, you could try this. Because often they're just they want as many options as possible.
I saw on your website you do LASIK, you do a lot of more comprehensive things. And how has that conversation gone with athletes?
I'll let Dr. Everett take the lead. He's our head refractive surgeon.
Oh, great.
Dr. Everett.
Yeah, well, interesting enough, I used to do a lot more LASIK on athletes. They're still having it, but I think a lot of them get to us on the professional level, already having had refractive surgery, which back before that wasn't something that they were really doing until they got into the professional ranks. But we, just like David said, we let them know that anybody who's interested in refractive surgery, to give us, contact us, and we can walk them through things. But I think a lot of the athletes these days, by the time they've gotten to the professional level, have already had LASIK if they needed it at a lower level in college. But did plenty. I mean, I've well over 60 athletes. Mostly football, some basketball, some baseball over the years. One of the things that, because we mostly work with the professional athletes, that you should realize is, especially football, but even basketball, at the NBA level, as David will attest, we let them know what's available, but nothing happens until the trainers reach out. I mean, it's if we were walking around saying, "Hey, man, I thought you might use our help here," we wouldn't be there very long. They're very, again, NFL especially, I think they would agree, very protective of how the athletes are, who interacts with them and how things go down and how they're treated. I would make a comment that I still think, for as much advancement there has been in maybe the neuro realm, especially with concussions, I honestly think, and I'd be curious if David agrees, I think NFL especially is still a little bit in the dark ages in terms of what they could be doing for vision and integration of vision and coordination and hand-eye and all that sort of thing. I think there's a lot of opportunity there that I don't think the NFL is really tapped into. For instance, this is a small thing, but we've never traditionally been invited to the combines, and at the combines they just basically do an eye chart, like, hey, can you see this? And given all the measurements they put these athletes through, it's shocking to me that they don't do more in terms of visual capabilities at the combine, especially for the skill groups, the receivers, the quarterbacks, the running backs. What do you agree with that, David? I mean, what's your thought on that? I'm curious.
I mean, it's almost like a perfect segue for me to talk about the boxing world too, Jared. That's what got me interested in it, because I was asked to do some physicals for some boxers here in Detroit, and my kind of my reward for doing these physicals on a Saturday was an invitation to the boxing match that evening. And so I went to the boxing match. I sat ringside, but I wasn't of any help to the medical staff there. And I watched them do this is amateur boxing. I watched them do their neuro checks, on a fighter who got knocked out, and they went there and did it. And the way they just moved the pen light in real fast. I mean, they weren't fooling anybody, and they didn't see anything. And I said, wow, they really need someone. The fighters need someone. Obviously the managers and everyone, the organizers didn't need someone, but the fighters really needed somebody there, almost to advocate for them, to do it right, to really understand the eye movements. And that was kind of the impetus for me getting involved with boxing initially. And so, kind of to echo what Kevin said, absolutely, we know eye movements a little bit better. We see them every single day of our careers, and pupil movements, and just recognizing just the slight differences could make the difference for the player. So there's lots of room for us to certainly be more involved.
We still, just to give you a little story, obviously no names involved. David remembers this. We still have players that'll show up. I mean, it's not common, but it happens. We had a player a few years ago showed up, had been picked up on waivers from another team, and had a optic nerve edema and a visual field cut, and had a serious problem. Nobody caught, because there's nothing beyond maybe a quick vision check that's going on. Like, when they pick up players on waivers, they if they're going to bring them in, they bring them in and they put them through the whole rigor, the orthopedic, the internist, everything else. I mean, I'm not advocating for more work for us, but we're never asked to evaluate these players, and it's always kind of made me go, that just doesn't make sense. But that's just the way they are.
So you both have experience across different sports. How does your role as sports ophthalmologist vary between sports, and even the things that you're seeing?
I think I would let David answer that. I mean, I'll answer it too, but David is our head with the Pistons, and then we split the Lions. And then, as you heard, he also does some other sports as well. So, if you don't mind, David, I'll have you take that.
Yeah, I think my approach has changed regardless of what sport it is. Uh, and it's probably the same approach that I'd recommend for everyone, but it's hard to kind of create it. And that is that when you're evaluating a player or athlete, they're not sure like who you represent. Who you're evaluating them for. And so the first thing you need to do is try to establish that rapport that says, "Hey, I'm here for you," and no outside interference. And I learned that very quickly because uh, and, any of your listeners who are residents will remember going down to the ER and during their residency and being asked to see a corneal abrasion or something or a corneal ulcer, and they realized how the lack of knowledge that ER physicians and whoever's rotating through there has for the eye. And that's not their fault. It's just because we don't learn a lot about the eye in medical school. And so when you're an eye resident, you are the expert in the ER. And no one should be telling you how to evaluate that eye. And the same thing goes, is true for when you're doing an evaluation, at a professional athlete level too. Undoubtedly you'll get called to a locker room to look at a corneal abrasion, and the teams will say, "Hey, we just want you to look at this corneal abrasion. Don't look at anything else, please. Just do that."
Yeah, yeah,
And you have to know, "Hey, I'm the expert here. I know what to do here. Don't tell me how to do my exam. If you want me here, if you want, a real ophthalmological exam, let me examine this." Because if a player at that level has a corneal abrasion, that was a pretty significant, trauma. You need to check the orbital rim as well. You need to check other things to make sure there's nothing else in addition. And so my approach, regardless, certainly the professional level is at first, to establish that rapport with the player. Hey, I'm here for you. I know I have a lot of people chirping in my ear here right now, and try to figure out a way to, isolate just you and them for a proper exam. Understand and then let them know your findings first, and then you talk to everybody else or ask their permission to talk to everybody else. But it's really it's the same across the board. All of them have some sort of contact in it. Whether it's hockey, football, or basketball. Baseball has been mostly kind of refractive concerns there, and a few infections here and there, when they're not playing. But and knock on wood, we haven't had any trauma baseball world. But
well, we
I don't know.
did actually. Remember that was a few years ago. Do you remember our very well known first baseman at the time was playing third base? You were with us. I don't think you were involved at all yet, but he had an orbital rim fracture in spring training, and then he had the concern for angle recession, and he never showed up. I mean, so that's a rare thing, but unfortunately, sometimes the players aren't the best at taking care of themselves because they're told to do things and they don't really follow through. So hopefully, he doesn't develop glaucoma at an older age. So
Yeah, I think a lot of these things that we're talking about are common just to medicine in general, but are important to keep in mind when you're working in a new arena, I guess quite literally. So for the resident or ophthalmologist that wants to get involved in this, what sort of recommendations would you have?
You know what? It's um, I'll tell you that I think Kevin's the best refractive surgeon in the state, but I will say I'm probably not. I'm not the I'm not the when I said who's the best ophthalmologist in the state, it's not me. There's lots of great ophthalmologists in our state. What I am is I am persistently available and committed, and I'm always there.
yeah,
And even if I can't
that's
be
it.
there, I let them know I'm going to find a way for them to be there. And
Right.
because I'm absolutely committed to making sure that they get the best care that they can. I know they can do it through our department. We
Right.
have no ulterior motives. I know we're not doing commercials, on the side, with the athletes, dancing for us or wearing, screaming our praises. We don't seek that. We really are in it for the athletes and the teams. And so I feel really confident in letting the teams know that. So if they know they can call my number or Kevin's number 24/7 and get a response literally within 2 minutes, they're not going to find that anywhere else. And so for any medical student that's going into that group, it starts in residency. And it's as if you're going to any business too. You got to read your emails. You got to reply. You got to read your text. You got to reply to the text. You got to be available. And that's actually a hard thing to teach residents. They don't all get that. And it's kind of it's crazy. No one answers a text honestly quicker than Dr. Everett. It's really impressive, but it's something that residents should understand, that your presence allows things to happen, right? I mean, if you're not there, if you're not available, other people will step in.
Yeah,
And so,
David is making, I think the two things I would echo here is the first part is to his, addressing his nexus. Nobody knows who the best of anything is, right? We're all do our very best. So it's not a matter of like, patients think that. They'll be like, oh, you take care of the Pistons or you take care of the Lions, you must be amazing. But they don't really know is that there's two things, and I'm echoing David, two things that go into this. The first is actually connections. We just happen to be with Henry Ford that over the years have had the opportunity to, I'll say there's three things: the opportunity to, take part in taking care of a lot of our sports teams, hopefully soon all of our sports teams. The second is hustle that David was just talking about, but the word I would use is concierge. I think we're ophthalmology concierge for not just the players, but the staff, the players' families, because a lot of the calls we get, and David knows, will say this for sure, isn't because player X has got a problem. It's because the owner's wife or the general manager's sister or the player's brother. And we're there for that too. And like one call, we figure out exactly where they need to get to. Obviously, we have staff that help us with this. And it doesn't matter if it's the weekend or the middle of the night or, wasn't that long ago we had the exact same situation with somebody very high up in one of the teams, like as high as you get, without any information given. And, it was middle of the night and weekend, and we're there for them. And I think that is couldn't be emphasized enough. We have to be available and not be annoyed by it. I mean, it's kind of cool that, we're being asked to take care of these people, and we're going to make sure that they're taken care of on a very quick basis. So concierge is the word I would use for that too.
Yeah, and I can imagine just the value in them being able to reach out to you. You're consistent, you're the guy, rather than kind of spreading that across like maybe the whole department.
No, it's David or I, David even more so, and then we will find exactly if it's something we can't deal with, it'll be taken care of by one of our partners like Pronto.
I can imagine that can be pretty demanding. Many people go into ophthalmology so they don't have to be on call. So what are some of the satisfying, what kind of joy do you get out of this type of work?
I mean, the same thing you get out of just the joy you get during 9 to 5 too. I mean, it's relationships, doing things that, over and beyond always bring other opportunities. So you never know what's going to come from seeing a patient at 12 o'clock at nighttime. It's rare, honestly, Jared. It's rare to have to go in or do things. That's usually a phone call. It's a picture sent. It's a confirmation of this. It's more. There's a little bit of an administrative angle to it, especially late at night, trying to figure out what's best for the patient next morning. And I think Kevin, I think the proper word, just like he said, I would echo it too. Concierge is perfect. I mean, that embodies everything that we're kind of doing.
The benefits of what we do, they're certainly not financial. I don't know what other arrangements are with other sports teams, but David and I, the only compensation we have is we have a ticket to the game, but we have to. So I mean, it's not like that's some crazy kind of compensation. So The benefits are interesting. First of all, the most direct benefit is completely dependent on how the team's doing. So right now, being a Pistons doctor isn't like the greatest, like, oh my God, even though patients like it, you're not thinking it's the most amazing thing. Being a Lions doctor, on the other hand, right now is like, people can't talk enough about it. So that's number one. Number two, David touched on it. And you're not doing it for this reason, but you do make a lot of connections and meet a lot of interesting people. um, this is my shout out to Dave. David's an entrepreneur besides being an ophthalmologist. He has businesses, restaurants, other things. David's phenomenal at this, but that is a side benefit. It's not why you're doing it, but you take care of people really, really well, and David's a nice guy, and I think I'm a decently nice guy, and they like you, and you meet people, and I would say over the years I've always said that despite not a single dime paid in compensation, some of the connections I've made have been, lifelong benefits and friends. And I bet you David would say the same thing. So those are the what I say is the benefits. And third, I would say, yeah, sometimes you are really, involved in directly helping a player get back on the floor or back on the field and make a play. And then you got a small little piece of saying, yeah, I'm actually involved in the success of this team. So I think all three of those are important.
Jared, when I have a boxer coming in for a screening, just or an MMA fighter preparing for it, and you do they bring you a sheet typically from whatever state they're going to be fighting in, and you're signing off on that, and the sheet typically will have what they want you to look at, and so I do the sheet, and then I put the sheet away, and I do a different exam for the boxer. And try to, and then I explain what I'm doing. So this is a little bit different, probably this thing that you haven't had done before, but this is why I'm doing it, so that you can recognize early signs of concussion based on your eye movements and dizziness, things that happen here too. So if you get rocked, hard, I want you to do this in the corner yourself, and then you can make the best decision for yourself and your family and your friends. Do you take a knee or you keep going? Because the fight doctor might just say, "Oh, he's okay," or whatever the situation you might be in. And I actually take a lot of pride from that conversation and seeing it in their eyes. We're like, wow, this doctor really cares about me. And I try to encourage you. Tell anybody. Anytime you're here in Michigan, you need anything, let me know. You come here for us, and we'll take care of you. These are not. They're not fighting for the heavyweight championship of the world, right? These guys are just trying to make it, and that's really the time to give them this insight that the doctors are not just a part of the signing process so you can get in the ring. They're there to really kind of make sure that you're healthy for your entire life, your family, and things that are important to you, because there is life after professional sports, and it's really nice to be able to see and talk and do everything.
In my case, it was just there is life after high school sports, but it's hard when you're in that situation as an athlete to have that perspective when everything you care about is that next big game coming up. And you don't want to tell the trainer about whatever injury you think you might have because you don't want to get held out. You'll play through it, and so just that idea of being an advocate for the athlete and protecting them from themselves and really just giving them that education.
Yeah, it's not always the nicest or easiest thing because sometimes the news is bad. I mean, this is going back some years before I had all the neuro people, but the Lions starting quarterback had their bell rung, and they said, go and check him out, and it was clear he had been concussed, and I had to tell him you can't go back on the field, and man, he was screaming at me on the sideline, and it's not always the nicest thing, but you're doing the right thing for the player, and that's what's important, in the long run. So I'm kind of glad we don't, don't have the direct role in that, because sometimes those players really aren't thinking of themselves in the long run. They're thinking of themselves in the short run and about the team. And that's not always the best for their own health.
Is there anything that you wish just the general ophthalmologist, let's say they're not specializing in sports, but they see an athlete or they're involved in the care of an athlete, whether collegiate or professional, what kind of advice would you have for the ophthalmologist that's taking care of an athlete?
I would jump in and quickly say, sorry to go first, David, but treat them like your own family and like that they're a patient that have a lifelong of needing their vision in their eyes. I do see, and I think David sees this too, the occasional time in our area an ophthalmologist gets involved in one of these athletes because maybe somebody sent somebody there. It becomes like a big thrill to them. And oh my God, I'm taking care of this lion or I'm taking care of this. And I think, I'm not saying they're all like this, but a lot of them end up, losing track of what they're supposed to be doing. And they're just all excited because they can take care of an athlete. So I would say first and foremost, take care of them like it's your family. Forget the fact that maybe they're paid $50 million to play football and just realize that they've got an issue and you got to make sure you take care of it. And that's all that matters. So that's what I would say.
Yeah, I would say the exact same thing. And in fact, I would say take care of them like a family, like any other patient that you have. Um, and absolutely, the first time, when some of the athletes will come to our hospital, and I like having the residents get introduced to them. In a way, it's a great way for them to kind of get used to this style of exam, but and not to waver for what they do. And it kind of goes back to my original thing where I said, when you go do that consult for the first time and you're surrounded by all these other doctors that are telling you what to do. No, it's you. It's you and the patient. You do what you do for every single patient, no matter what. You don't skip steps. You skip steps, that's when you miss diagnoses. So, yeah, treat them like family. Agree.
And can you speak just really briefly to the idea of involving residents in this type of care? Like, are they allowed to observe you or shadow you, or how does that process go as far as training future sports ophthalmologists?
Dave is
No,
going to
just
answer this because he's
they're
I'm going to
helpful.
set him. Yeah, I'm going to set David up here. He's the best residency director in the country. I don't care what anybody says, and he's been fantastic in involving our residents in various parts of us taking care of the sports teams. And I'll let him be more specific about how they get involved. But I want you to know that this is an amazing residency director you're talking to here. One of his many hats.
No, the residents aren't just, they're there to help, and they're actually critical to our whole mission of providing this level of care to the professional athletes. When I say 24/7, it's not always Kevin and I getting out of bed to come. We have a residency program there for us too. Um, and so any opportunity I get to get them involved, they should be involved. It's nice to see them interact. I love the fact that half our residents don't know who the players, can't even name one person on one of the teams, because they're coming from another city. And there's actually probably, there's no starstruck. It's limited starstruckness, I guess, with the residents when they're meeting the players, and I love to see that. Only afterwards do I tell them, who they are or their background. The residents help with physicals for certain. They do a lot of the heavy lifting with the physicals because it's busy work there. A lot of exams. With the Lions, you're doing the coaching staff, the rookies, the veterans, and it's 3 separate days, all with something like 40 exams to almost 65, 70 exams in a day.
Yep.
Their involvement is essential.
It is an advantage to our program, though. David's being a little bit humble about it. I mean, when we do residency interviews, I've had residents, I'm sure David has many times, bring up the fact that we take care of the different professional teams and what's that like, and is there something, how do you get involved in that? I mean, I would assume that's a conversation you've had as well, David.
Yeah, I think it's kind of when the residents or the applicants are going through all these interviews and it's all virtual now, and so at some point, all the interviews start to seem very similar. The same process, and so any topics that no other program can really advertise or talk about a lot, or where the residents can see potential for them to be involved in, is exciting. And so, yeah, it's probably a favorite topic of students when they are interviewing with us. But the truth is, probably I've only done research with some of the, for the past maybe 10 years. There's only been about 3 or 4 residents that have come to the program and said, I'm still all in sports. I love this. I want to do as much as I can. What research topics can we do? And that field is wide open, which is the beauty of it. I mean, it's a relatively new field. So if you bring a research topic, we have resources. It's great, and those residents really thrive. So yeah, it is something special that we have. I imagine we're one of the very few ophthalmology departments in the entire country that can really boast that they take care of the four major sports teams in a city. And as of this year, we do all four, and the amateur teams too. And it's just really cool to build a program that's you are the go-to place for this sort of thing because of the trust that the teams have kind of developed with you.
Before we sign off here, anything else that either of you would like to add?
I guess I would say that I'm glad that you're doing what you're doing. Because like I'd alluded to some years ago, there was a sports ophthalmology society that I was a member of before David got involved. And, I would always be like, okay, what are we doing? And it just sort of died. I don't know what became of it. That particular society doesn't exist anymore. So I was really glad when you reached out. I know it took us a while to get this together, but I'm glad that there's some interest here because it is a unique part of ophthalmology that most people don't see. But as an ophthalmologist, you do see this at all sorts of amateur levels in terms of it could be the kid who's just got whacked in the eye with a soccer ball, and I'm sure you've had this experience of to diagnose angle recession on a kid like that, or had a hyphema, or so, from the earliest of age all the way through the athletes, the pro athletes, it's an important field. So I just want to say thank you for drumming up interest in it.
It's certainly a field that allows for collaboration with all the other medical groups, or between whether it's ortho, neuro, psych. I mean, a lot of different divisions, and it's really nice when we're part of a medical group that can offer all those and be part of the whole sports medicine team. I think that any ophthalmologist that kind of oversees a team should be, make sure that there's they're part of the sports medicine team at all their institutions. It's good for the patient. So,
yeah. And real quick, we ask all our guests, what's your favorite sport or your favorite sports team?
Go ahead, Kevin. I want to take this.
Well, mine is definitely football. It's not even close. And depending on the year, it'll go back and forth between Michigan, which is my alma mater, and the Lions. Last year was probably Michigan. This year might be the Lions. This is my favorite team.
Jared, I grew up in San Diego, and my dream growing up in San Diego was to be the team doctor for the San Diego Chargers.
Mm-hmm.
And so I was 100% ortho bound my entire medical career until I found ophthalmology. I loved orthopedics. I loved the camaraderie in the locker room, basically, with the orthopods. I did a rotation at Hopkins, and the residents there actually had a gym in their resident room, and I thought that was the coolest thing I've ever seen. But then I did a rotation in ophthalmology, and I said, wow, not only do you get to do clinic and surgery, build relationships, but this is really cool. Everyone's happy. There's not surgeries are so precise and clean. This is for me. But there goes my sports, team doctor ambitions. But it's funny how things kind of come around. If you're passionate about it, I guess it finds its way. So, and now there's no longer any San Diego Chargers. So I can definitely say I really, I enjoy the players. And I think we're in a unique position where we get to meet the players and learn about them and know that they're more than just a part of the team that they're on at the time. And so I don't know. I honestly, I'm going to disappoint you, but I'm not going to be able to nail down which team is my favorite. It's whatever team I'm at the game for, I guess. They're my favorite team. So it's constantly changing every day. That's such a safe answer and weak answer. No, I'm sorry, but it is.
No, you won't be the first that answered that way too. So, Well, yeah, and I mean with Jim Harbaugh going to the LA Chargers, maybe the two worlds collide. Both you guys can be Chargers fans now.
No. I'm still, Lions are much more, Lions completely trump the Chargers for me now.
Thank you for listening to Sports Ophthalmology. To stay connected and learn more, you can find us on Twitter, YouTube, and at our website, sportsophthalmology.com.